Support tab. We are now ready to kick off the very first day of the conference, centered around the theme Promise and Pandemic, Reshaping Science Advice. During our opening plenary, Reflections from COVID-19, Where to from here, panelists will look to lessons from the pandemic experience that can inform the theory and practices of science advice going forward. Please welcome the moderator of this session, Jeremy McNeil, the President of the Royal Society of Canada. The panelists are Joanne Liu, Professor at the School of Population and Global Health at McGill University, Pharn, Principal Foresight Strategist at the Center for Strategic Futures, Andrea, Ammon, Director of the European Center for Disease Prevention and Control, Rafael, Radi, President of the National Academy of Sciences of Uruguay and Coordinator of the Scientific Honorary Advisory Group to the President on COVID-19. I now give the floor to Jeremy McNeil.
Good morning, everybody. It is a real pleasure to be here. And as you've been informed, unfortunately, Mona Niemer was unable to be the moderator of the session today due to our federal election, so I am stepping in at the last minute. Clearly, we have gone through a very difficult period over the last 18 months as it relates to providing science advice. Obviously, working in many cases without all of the data that we would like to have in hand, as it was a work in progress, if you like. Although we did have some background as it related for some people with SARS in previous outbreaks. However, it not only was that we were moving forward trying to provide advice as we were gaining information, it became a lot more complicated as the pandemic went on, and then there were the impacts on the economics, the education, the mental health of individuals, and all of these complicate matters. And it put a great deal of pressure on those providing advice. However, as always good academics, one learns as one goes. And today we have an expert panel that will be addressing what did we learn during these last months, and how can that help us as we move forward, providing reliable evidence-based advice to policymakers around the world, be it nationally or internationally. And so without any further ado, I will move over. You have heard who the panelists are, and I'm going to start with Dr. Andrea Ammon from Germany, and I will ask her, each one will speak for 3 or 4 minutes, and then we will open up the floor for a discussion, including addressing questions from the audience. Andrea.
Yeah, thank you very much, Jeremy, and thanks for the invitation to this conference. I would like to introduce briefly ECDC before coming to my 4 observations that I would like to share with you. ECDC is a supranational agency of the European Union with no regulatory competence. Our primary task is to identify, assess, and communicate threats to human health from infectious diseases. So scientific advice is our core task. In 27 very different of course, sovereign countries in the EU with 450 million inhabitants. And I mean, as everybody who is probably here on the panel, our experience was that during this public health emergency, providing scientific advice was really very challenging. The time was limited, scientific uncertainty prevailed more than the certainties that we had, and political pressures were high. And in the end, the evidence that we wanted to convey or needed to convey was usually not there. And that is the case still on this very day when we're discussing boosters, for instance. Now, in general, my observation is that giving scientific advice has not changed very much in the last 30 years. This is approximately when I did my master thesis in my public health school on the transfer of research into political action. And the conclusions are next to similar now. So first of all, giving scientific advice involves a very strong component of communication, of course, but also relationship. And in the end, it is built on trust, mutual trust from the scientist to the politician and the way back. Second, politicians and policymakers, they want to have advice based on evidence, but please in practical terms and not with all the pros and cons and the niceties about the uncertainty. Third, the population, in my view, is a client for scientific advice that is sometimes addressed directly by scientists and sometimes via the policymakers. But in the end, they have to understand the evidence as much as the policymakers. And this community engagement was, for me, a very clearly lacking part of this pandemic. Results now in pandemic fatigue, people not following the advice, and maybe also contributing to the vaccine hesitancy. And lastly, for me, in this my time in the organization at ECDC, it's the first time that the evidence that we produce has been used by politicians for far-reaching measures, for instance, travel advice. And that puts another pressure, in my view, on the quality of this evidence that we haven't seen so far in the past. So that's, I can expand on any of these points, but I would leave it at that for the moment. Thank you.
Thank you, Andrea. And now I would move over to Chor Lee from Singapore, who is the principal strategist with the government. Chor.
Hi, thank you. And I'm very happy to be here. So I'm a little bit different from, I think, the rest of the experts on this group. I am a futurist. I work in the Center for Strategic Futures, and what we do is we look into 10, 20, or even more sometimes years out. And so to look out well, sometimes we also look back maybe twice as much. So we try to be historians, in this case, historians of the future. And historically, science advice was shaped by large events. For example, the American Department of Energy was set up in direct response to the oil crisis in the 70s. And how might the ongoing pandemic influence the future of science advice to government? And here I just want to talk a little bit about time. And what I do in my work actually is we focus on time, or the nature of time, a lot. There's such a thing as peacetime, and there's such a thing as crisis time. And these different modes of time mean different things to science advice. And if you take the word science and advice, and then you put it in a 2x2, which is peacetime, crisis time, all right, and what sort of science you have on the horizontal side. What you come is maybe 2 or 3 observations here, all right. On the upper left quadrant, which is peacetime intersection with science, it's mostly what we call classic science advice, all right. This is essentially technical input to regulatory agencies, to large national programs, and the science we have here simply denotes natural sciences. And what is the mode of time here? The mode of time here is meant to be slow. It is meant to be deliberative, all right? And it is actually designed to be like that because, all right, there are lots of processes, etc., and lots of details to be covered. Now, obviously, this is not a good fit for crisis time, all right? Now, the right quadrant is crisis mode advice, all right? And then we can talk about the types of sciences here. And I'll cover it very briefly here. This is where policymakers find it very hard to balance between credibility and rigor versus timeliness and urgency. And Andrea has covered this a lot here, all right? And just to use a pandemic as an example, science itself may give us vaccines, but pandemics are social by their very nature. If you break it down, pandemon, the whole of humanity here. And this is the social part. Where there are social spillovers, we need to marry natural sciences with social sciences, like anthropologists and so on. And we need to also marry this with engineering, because it is not just the science of it, but it is the ability to scale up solutions like tracing, testing quickly and iterating. And these need to be in the room or around the table when we talk the natural sciences, the social sciences, as well as engineering capacity. Okay, capacities. The capabilities generally are there. It is the capacity, as we have found out during this pandemic here. Now, having said all this right quadrant is not an easy place to be with, because decision makers are actually human. They're very prone to biases. They're very prone to pressure. All right. And generally, science and policy making come out looking poorer for it. So as a futurist, what we normally say is, can we look upstream, okay, and invest in building up resilience and to identify blind spots? And this means investing in the lower left quadrant, which is peacetime mode. In this case, you have natural sciences plus social sciences plus engineering here. And I can talk a little bit more later. But the idea here is to run small scale experiments. They could be around the table exercises, war gaming, what have you, because you will start to identify blind spots and response capacities and capabilities, maybe even, that you need to build early on. And most of the time we find that this comes in the form of networks. Why? It's networks need to be built up early on, not just coordination among scientists in a growing G0 world, but also with, say, social scientists, all right? And also with engineering capacities here. And I'll just wrap this up quickly, is that as we build up these capacities and pools of trust way beforehand, we will be drawing them down. We'll be drawing down these pools of trust during a crisis mode. So when we move to peacetime, we need to invest in building up these capacities, capabilities, and networks. And that is, I'll just wrap it up here, all right? Because I think if you want to start building up pools of trust during a pandemic, or crisis time, that is very, very hard. Thank you.
Thank you, Chor. I would remind everybody watching that you can write in your questions on the using the question technique or approach, or the question function, and please do so. You have these experts available to you. Next, I would like to pass over to Rafael, who is the president of the Uruguayan Academy. Rafael.
Thank you, Jeremy and colleagues. Thank you to the past president and president-elect, acting president of the International Society, for inviting me. And thanks, Jeremy, a colleague and friend, for chairing the session, and of course, my colleagues that are sharing the panel. It's a real honor. So, in March 2020, a new government was installed in the country, and in March 13, the first 4 cases of COVID-19 arrived to Uruguay. And the government requested myself to assemble a group of scientists to advise the government in connection with different ministries, including the Ministry of Health and other government agencies. So the agreement was to have an independent and interdisciplinary group, which we assembled, of 60 scientists going from internal medicine all the way to mathematical modeling. And this group performed for 15 months. We just resumed our activities last month with over 70% of the fully vaccinated population under epidemia at this time under control. So independency and interdisciplinarity were key aspects for the performance of our group. And we identified 4 fronts that we should cover to protect the process, which was challenged, as Andrea was indicated, by uncertainties, political pressures. These 4 fronts were the internal front, meaning the 60 people has to be a real team, and we need to talk to each other and be good colleagues and friends. The second front was the political front, both with the government and the opposition, to have a fertile dialogue with executive power and the parliament. The third front was the society itself, which we learned was trusting us, the scientists and the science. And for the first time in our country, science had the visibility that never in our history had before. People learned that there was a scientific system behind us, and that was good. And the fourth front was the connections with the health sector and the scientific sector that were not part of our team, but that we had everyday connections so that everybody was on the same page. So these four fronts were protected over the whole process. And another aspect, and this is the third aspect I'd like to point out, that is that we generated public information. We generated over 90 reports that are public in the presidency website. We provided the reports to the government first, and within 24 hours, independent of what the report said, and independent on either if the report concluded with an action or not by the government, the report was published and open to the press and to the public on the next day. So that was a very transparent process. All these reports are public, of course. All these reports also facilitated the following. Instead of having a plethora of opinions on all the topics and a series of commentators on the pandemic here and there, we had a consistent, pure voice coming from the science after all this internal process was generated. I clearly remember when the Gamma variant, the Manaus P1 variant, arrived to our countries, there were many voices and many possibilities of what would do to the evolution of the epidemics in Uruguay. And we spent a whole week, a big team of people trying to dissect what was known, what was not known, and what can we provide for scientific advice. And I think that that was a good example on how scientific advice was able to eliminate much of the noise about these variants of concern arriving to Uruguay in our first and long first wave that we had between February and May. In addition, these consensus reports created trust and transparency for the public. And this is the engagement that you also were talking about, which is so important. Human behavior in the context of a pandemic control is central, and for that, trust is fundamental. And to round up, something that we said loud and clear from the very beginning, our group was going to neutralize as much as possible partisan divide. Partisan division is a risk factor in a pandemic. And we made it very clear to the public, to the society, and to the parliament that as much as we could, we were going to minimize this noise on the course of the pandemic. And just to round up, when we finished, and I'm proud of this, 90% of the population supported what the advisory groups did, independent of the political party. The support was equal. So when I saw that, we said, work done. Thank you very much.
Thank you, Rafael. And now last but not least, Jean-Loup from Montreal.
Good morning, good day, everybody, and thank you very much for this invitation. Thank you to the chair and to the presidents. I would like to give an intervention that would be based on 25 years as a humanitarian aid worker, tackling epidemic and pandemic, and as well as from my participation on the independent panel called the Independent Pandemic Preparedness Panel for Response to evaluate the response to the WHO. I think I missed on this, but it's called the IPPPVR. So a couple of things we've learned, globally is basically knowing that we went to SARS, knowing that we went to Ebola. Regardless of all the experience we had, the world was not prepared and the world didn't learn. 12 commissions were done across the world, coming with hundreds of recommendations. Less than 10% of them were implemented. So this is the state of play. When we got the first, we say, cases in December 2019, what is clear to us is when we look back is the international health regulation were not conducive to get and basically declare what was going on in terms of a pandemic. As soon as we should have known and about the fact that there were possibly human transmission, precautionary principles should have been implemented. Instead of that, we decided to say not enough proof. What happened is the month of February 2020 ended up being a lost month. People waiting for evidence, people waiting to find out, what is the core, I would say, proof of things. That ended up delaying response. That ended up as well leading some countries to devalue science, deny the severity of disease, and then contributed to a delayed response. That in itself contributed to distrust from the communities, from population in general. So my question when we talk about advice, science advice, is how do you advise when we are building evidence? How do you advise when you are building slowly yet emerging evidence, when you don't have a foolproof evidence, but there's mega trends? How can we use that and apply the precautionary principle? The other thing is it's about the fact as well that we've discovered, that science has delivered. They've basically saved the day. They created a vaccine. We didn't deliver. We didn't deliver as human. We didn't enact a global solidarity that end up, making sure that everybody comes at the finish line for COVID-19. We have countries who've been hoarding vaccines. More than 75% of the world stockpile has been purchased by 10 countries. And today, 17 months within the pandemic, people in Africa are basically dying, gasping for air. Healthcare workers not protected. More than 17,000 healthcare workers have died so far. This is going to be hard to replace. We are at a historical moment. We need to come together as a world because we have the tool. We have some tools, and the tools like vaccines, diagnostic tests, treatment should be considered as global public goods in times of pandemic. We should as well consider basically investing on preparedness and surge capacity upstream. It's about investing billions of dollars on a yearly basis to basically save trillions of dollars. We know that by 2025, there'll be a loss of 22 trillions globally. That's going to be the economical impact. We know as well that if we want to do better next time around, we're going to need to apply the precautionary principle when we're going to declare a public health emergency of international concern. It needs to be based on clear, objective, and published criteria. But last but not least, my plea to you is to make sure that the politics support the science, and the science, it's not there to support a political agenda. Thank you very much.
Thank you very much, Joanne. I think that's a very important point that I think has been brought up by a number of the questions as well that we've received. One from Dimitri. And the question was that during the ongoing crisis, governments have chosen not to follow expert advice on what needs to be done. This has led to inconsistent decisions, and in many cases has made it worse. And as Remy mentioned at the very beginning, we're also combating modern technology where we're getting experts posting right, left, and center. How do you think we are going to be able to move forward in our communication, not only with the policymakers, but also with the public? Because you all underlined one thing, the need to have trust in what we are, in the advisors. Anybody wish to leap in at the very beginning? Joanne.
Well, I'm the one who doesn't do politics. I mean, you mentioned aid worker, but and then you can contradict me afterwards. But I really think that it's a question of transparency and openness. It's about saying at the outset, as leaders, This is what we know. This is what we don't know. And this is what we wish to know. And if you keep the population on board on your uncertainties, that will work. We've done it in West Africa during the Ebola crisis, when we didn't have all the I would say the element. But by when we got to know that we have to keep people in check with what is happening in real time and telling them our uncertainties, it helps. But it needs to be done in a savvy way, because it does create a lot of uncertainties, and creating more uncertainties, it's a lot of as well of downstream damage control. But telling people with certainties about uncertainties, let's take, for example, the mask. No, it's dangerous. You might even infect yourself more. And doing 180 degrees afterwards, that's really hard after that to implement. And this is all what we went through anyway in Canada and many other countries.
And I call on, yes, Andrea.
Yeah, thank you. I just want to pick up the last issue that Joanne mentioned, because indeed many people cite this reversal around the masks as their reason why they didn't and why this is all a sham anyway. So I think this is true that the evidence really changed around the masks, and what was missed was basically explaining very clearly, maybe also from us to the policymakers and the politicians, but definitely to the population, why this change is now coming about. And in terms of, and that's just one example. There might be, might have been other examples, but that was really also in Europe a very prominent discussion where countries had really a wide implementation of the mask mandate, from basically not doing it at all to FFP2 masks and everything in between. So, but I want to come back to the population, because I believe that again, I mean, this is not a matter that you can do in crisis time. You have to do this in non-crisis time. Really build the links and the relationship to especially particular communities that are more prone of distrust to the government and the advice. To win their authoritative figures that have the authority and the trust also of these communities, to establish a trustful relationship that you can use in times of crisis. And otherwise, this will not work.
Okay. Rafael.
Yeah, thank you very much. I think that in science advice, especially in challenging times when things need to be transferred fast, we still need to keep in mind that there are different periods of the process. First, you have the internal period. This is the period on which the group analyzes all the existing evidence and then synthesizes it to generate a consensus view. This is period number one. While we do that, we need to keep the internal work. Then you have the second phase, which is the transfer of this. The transfer to the government and the transfer to the society. But when we reach that point, we need to very clearly communicate what we know and what we don't know and what we wish to know, as it was said previously. But I don't think that it's a good idea to get a paper on a repository and instantaneously send that in Twitter just to create a sensation of immediate danger, as is all the time happening with the variants, which is a big issue. This is why we spent so much time analyzing the Gamma variant before discussing with the government and the public. And I just want to put one example. We challenged the idea back in April 2020 that kids were the first or the most important way of transmission of the disease, because this had a direct impact in a school opening. So in late May 2020, we created a 20-page report that we discussed with the government over many days. And then there were 2 press conferences, one by the Scientific Advisory Board and one by the government, to tell parents and the society why we would go ahead and start a school opening as early as May 2020. This was very early on the process, because there were lots of uncertainties. And I remember even physicians and people telling us, you are going to go to jail because you want to open schools. So we need to be very serious on this. And transparency doesn't mean low quality analysis. So number 1, internal work, number 2, transfer. And these 2 phases are, in my opinion, quite different times. Thank you.
Prof, if you would like to say something, but before you do, there has been a request for access to your diagram that you mentioned. And I don't know whether there is some way that at a point it can be posted somewhere, because a number of people...
I think it is among the collection of essays that has been sent out earlier. It's probably on the website. I got a copy of it, a PDF copy. So if anyone is reading it, it's on page 11. Okay, I just went to thumb through it.
Thank you. Okay, so.
Yeah, so once again, I'm not a medical expert, and I am just a civil servant, all right, and a futurist at that. So I still want to come back to one thing though. I think I'm stating the obvious, but we are looking at a pipeline of lots of shocks coming down, all right, not just climate related, all right, but we could also see some things that have huge social spillovers, and things that were once beyond the pale start to be considered, like geoengineering, for example, and that will have a lot of social impacts coming down, or the mainstreaming of synthetic intelligence. And I mean this in a serious way, because it is moving in rapidly into mainstream use already, thanks to GPT-3, 4, and so on. What I think it is sometimes a lot less the natural sciences here, but we need to get a conversation going on with anthropologists, all right? I say this again, actually, who understand perhaps how societies work, and we need to have a language how do we approach, say, an issue with lots of social spillovers, and don't do it during crisis time, all right? So here I want to come to something though, which is peers. Who are your peers here? P-E-R-S, the peers here. And it is interesting to think about, and one practice that we use is who is experiencing the future right now, or who has experienced the future? Because the future is almost always here, but it's not evenly distributed. I think, Jeremy, you mentioned SARS earlier, all right? So that's in a way countries or territories that have experienced a certain version of the future, okay? But some European friends of mine pointed out that when their societies or their agencies were thinking through how to react, they didn't take into account the experiences of some of these economies in Asia that have gone through it. So one thing is, let's expand our idea of what are peers, all right? Let's look out for who is experiencing the future or has experienced the future and go through it, all right? History is a very, very good instructor here, all right, on what to do, what not to do, and then take some of these things back, customize it, run them as tabletop games, simple, small tabletop games, and then you will have a quick sense of, hey, someone is missing from the table. And a lot of the times, it might not be the natural sciences, it could be the social sciences, all right? And a lot of times, it is also the engineering capacity, because you might need to scale things up quickly because you may have assumed you can buy everything off the market, but maybe the market is not working, all right, in those cases. So I'll just stop here.
Thank you. As everybody's noted and everybody realizes, this pandemic has put the spotlight on science advice, and it's from all sectors, including the public. At the Royal Society, we actually struck a COVID-19 panel But because we cover everything from the arts and humanities to the hard sciences, we actually came up with policy statements relating to long-term care, the disease itself, racism, etc., and all various aspects. But it's become very clear that we have to reach out in many different ways. And I'm wondering, is there, given the way things have happened and the experience you've all had, are there some sort of what one could call low-hanging fruit that we can actually exploit as we move forward to make sure that we have a better communication with the public? For example, we teamed up with newspapers and so on and had public webinars and so on and so forth. Are there things we can learn from this that we can ensure that these are used in more effective communication at all levels, not just with the policymakers, but as we've seen with the public as we move forward? Anybody want to leap in on that one? A dead silence. My goodness. Well, in that case, as nobody wants to pick up, yes, Andrea.
Well, I mean, I was hesitating because I don't see any low-hanging fruit. I mean, there is, of course, things that can be done, but I am not sure there is anything where we find a quick solution. I think it needs to be built. But I think the building can start now and has to start now, so that we may, even assuming that we still have another, let's see, at least half a year of this pandemic, reap some fruits. But it's not quick. So as I said, I mean, the reaching out to these community leaders is for strengthening the community engagement certainly a necessity. For me, it would also be absolutely necessary to put these chapters on community engagement in the future pandemic preparedness plans that everybody hopefully will be now revising with the lessons that we have now learned. So in that sense, but we also need to incorporate into the training of scientists, because I mean, scientists are usually feel not comfortable, you know, breaking down their elaborate and sophisticated scientific treatises into layman's words. I mean, I have at least experienced this in my organization, that when it comes to really bringing the conclusions in simple terms, they struggle tremendously. So I think there is something that we need to start, what we can start already now doing.
I say in my term of low-hanging fruit, I should have probably said more easily approached at this point in time. Joanne.
Thank you for your intervention, Andrea, and I fully support what you said. And I think that we have to be clear. There's no quick fix, and then we cannot wait for the next time around to invest in community. And so right now, just for example, we know that in the global north, we're starting school, and I think going to actually student association and making them part of the response and giving them ownership of the response. And I'm saying that because I really do think that during this pandemic, somehow there were a lot of top-down, but less bottom-up approach. And I think that is something that needs to be empowered more and be enacted more than what it had happened so far. So making sure that people are owning the response. I've seen it in so many places where I've tackled pandemic. And then when people understand that they are not, I would say, passive actor, but active player, active responder, and game changer, it makes a huge difference. And for example, in West Africa, initially we told people, come to our Ebola center, and then we don't have any treatment. We don't have we don't have any much to offer. You might die alone. And people don't want to come. When we try to say, but this is how you're going to protect your people. But the thing is when they figured out that in order to protect their community, they needed to isolate themselves, They did it themselves on their own, not even to come in Ebola Center. They were part, and this is what we call the miracle of West Africa, is when people took ownership of the outbreak, that was the game changer. So the secret weapon to a pandemic are people.
Thank you. That is very important. One thing I think one needs to also consider that we, as science advice, we're moving forward, but we're also not just dealing with pandemics, but we're dealing with things like climate change. And many of the lessons we have learned here, I believe, have to be developed and used in the most effective manner, because it is becoming a serious crisis right now. Rafi, you said you put up your hand there.
Yeah, very briefly, just to complement some of the comment of Joanne and Andrea. I think if we talk about science advice for the future and the lessons learned, I think that there is a clear difference between the countries that already have well-established scientific systems, let's say North America, Europe, Japan, Australia, New Zealand, and other countries like Latin American countries, like the one I am, that we have a developing scientific system that now for the first time has been shown to the public that it's there and can be really have an impact. So part of the lessons, and as Andrea was saying, that we have learned, and we need now to build this with the government authorities for the future, is how to further foster the scientific systems, because we don't have that tradition, and also how to position science as part of the human rights in dialogue with other human rights, such as the right for health, the right for justice. So the human right dimension of science has to be put in place in a much stronger position in the developing countries. So I would not like to think that for our country, this was just an anecdote of the scientific system to come for 1.5 years and then go back and things will stay the same, but to give us an opportunity, and for many other countries also, to put science in the next level. So this is my comment.
Well, thank you, Rafael. Very clearly, we need to be thinking about not only how we move forward, but how we train those coming after us to do this in the future. We only have about 3 minutes left, so I would like to do one round, starting off, going backwards this time. Joanne, would you like to make one very quick closing statement for each one of you? Joanne.
Sure. Thank you very much. I think that this meeting is really important. We need to learn, and so we need to avoid the double fault of not being prepared and not learning. So this is in our hands. There's going to be a lot of pressure to forget, for collective amnesia, because we want to move on. And then my biggest worry is that COVID-19 become the neglected pandemic of the poor. It's in our hands to get to the finish line, all of us together.
Thank you, Joanne. Rafi.
Yeah, I work in the main university of Uruguay, which is public. After all this, the increase of students starting scientific careers was enhanced in 2021 by 45%.
So hopefully this will, and just out of curiosity, are you including as a component of the education outreach and teaching them how to do outreach and science advice?
Yeah, and also we need to know what we will be doing with these people after they finish 5 years from now.
That is true. Shofan, your last thoughts?
Oh yes. So looking into the future, all right. There's a high likelihood, I would say, there's a high likelihood we will experience a lot more of what I call crisis mode, all right, rather than peacetime mode. I think it is important not to forget, all right, the flux, the confusion, and also the pressures on decision makers. They are humans, they are very prone, okay, as all humans are, to biases and pressure. So how do you meet them halfway, all right, at least halfway there? So it's not just communications, but it's also building those pools of trust during peacetime, so you can draw down on them during crisis time. And I think there will be a lot more to come. We should not, as Joanne has put it, we should not forget this time that we've been through for the past 16 months. Thanks.
Thank you. And last again, but not least, Andrea.
Yeah, thank you. I think scientific advice is more than research. I mean, research is very important. It has to be high quality and independent and relevant. But scientists need to know it's not sufficient. They need to see it through implementation and changing public health practice or any practice, what the respective science is about in non-crisis time. And they have to build this, as have been said, so that in crisis time, it's there and can be used much more accelerated speed.
Well, thank you all very much. This has been very informative. I think we have a very clear mandate as we move forward. We have to think carefully, think of the lessons we have gained, and we must move forward to make sure that we have the trust, and not only of the policymakers, but of the public as well. And we need to do it at an interdisciplinary level, going with not just science, but with the social sciences and the arts. Thank you all very much indeed.
Thank you, Jeremy McNeil, and all the panelists for this extremely relevant plenary.